The latest now on the ongoing coronavirus concerns. More cases of the virus were announced today. There are now 176 infections in at least 19 states.
Here at home, Governor Gina Raimondo and state health leaders say additional measures are being put in place to limit and prevent the spread of the coronavirus.
Now, right now, there are 2 positive cases in Rhode Island. About 200 people are now in self-quarantine.
A case in Massachusetts is linked to the Rhode Island cases. Health officials say those are all based on a school trip to Italy with St. Ray's Academy. Eyewitness News reporter Alexandra-Scott was at this morning's briefing. Alex, what does the Department of Health say about this larger number of people being quarantined now?
Well, we're told that that figure was due to anyone that had direct face-to-face contact with anyone who had tested positive for the virus. Now, St. Ray's, the school in question, announcing yesterday that it would be closed for an additional week, and today it announced that a school trip to Spain next month has been canceled. Today, the governor with additional advice to any schools that have trips abroad.
I'm also calling on all high schools and colleges and other large organizations to cancel organized trips abroad.
Governor Raimondo with this request, in addition to announcing new guidelines to prevent and limit the spread of coronavirus. So far, the positive coronavirus results in the Ocean State are linked to a single school trip to Italy.
At that point, Italy was not part of CDC's guidance for evaluating COVID-19 cases.
Today, we learned Rhode Island School of Design suspended all school-sponsored travel for the rest of the spring semester. Governor Raimondo says she's also directing any state employees who traveled to coronavirus-affected areas to stay home for 14 symptom-free days.
And I am personally asking all employers in Rhode Island to consider that policy or similar policies.
The governor also announced a 5-person team from the CDC's Epidemic Intelligence Service arrived in Rhode Island,
working on a daily, continuous basis with the Department of Health.
The Rhode Island Emergency Management Agency will also be involved in new testing capabilities
to set up additional testing sites around the state, not necessarily in traditional healthcare environments.
Now, the governor said more testing kits from the CDC would be made available this week. One other big message from today: call your doctor. Don't come into the office if you think that you're sick. There is also a dedicated COVID-19 hotline with the DOH. That number listed on WPRI.com. Live in Providence, Alexandra-Scott, Eyewitness News.
Now at 6, we're working the latest on the concerns about the coronavirus.
Now, the governor says the risk to Rhode Island remains low, but they are implementing some new measures as a precaution. You can see some of those headlines at the bottom of your screen there. Right now, the Department of Health is briefing members of the House Health Committee. So far, there are 2 positive cases of the virus in Rhode Island, with 8 test results still pending.
And the governor is asking schools, colleges, and large organizations to cancel any organized trips abroad. St. Ray's in Pawtucket says they're canceling a planned trip to Spain next month. The school remains closed through next week following the positive cases linked to the school's trip to Italy last month. The governor says all state employees who have traveled to China, Italy, Japan, South Korea, or Iran in the last few weeks will be asked to stay home for 14 symptom-free days. She's asking all Rhode Island employers to adopt a similar policy.
The health department says they have a sufficient number of tests on hand. They're also working to set up additional testing sites apart from healthcare facilities. 5-member team from the CDC is now in Rhode Island working with the Department of Health. This afternoon, the U.S. Senate overwhelmingly approved the emergency funding bill passed by the House yesterday. Now heads to President Trump's desk.
And back here in Rhode Island, the governor and health director say it's important to protect the most vulnerable from the virus. Eyewitness News reporter Alexandra-Scott joins us live from Providence with that part of the story. Alexandra?
Well, that population includes people with chronic health conditions and the elderly. It's meant to change in policy for visitors to both nursing homes and hospitals. So far, all positive coronavirus cases in Rhode Island are linked to one single school trip to Italy. 2 positive tests and nearly 200 now quarantined at home.
And right now, the evidence and science tell us the risk in Rhode Island is low.
Despite the low risk, that evidence shows COVID-19 hits those with chronic health conditions and the elderly the hardest.
Folks who are in the hospital and who are in a nursing home are vulnerable.
The Department of Health with new guidance related to visiting hours in both places, including no one under the age of 18 to visit.
If you're not feeling well, please refrain from visiting a loved one in a hospital or a nursing home.
This is a place where all of us can work together to make a difference.
The governor also announced an effort to protect healthcare workers. The Hasbro Heroes Ball, scheduled at the convention center this Saturday, now postponed.
We really have to make sure we don't get into a situation where a large number of our doctors and nurses and therapists and clinicians are themselves quarantined.
Now, the DOH director told us again that people without symptoms will not be tested and that the tests actually work better with people who have symptoms consistent with COVID-19. They add that more test kits from the CDC will be made available this week. Live in Providence, Alexandra Leslie, Eyewitness News.